First off, Senator, for you, you were part of that meeting with the President yesterday on health care. What did you take away from it?
Well, I think the President was just stating that he too believes, as I do, that now is the time for health care reform. And I think we need to move forward and get this bill done before the end of the year.
What kind of bill do you see shaping up now?
I think we have a pro-patient, a pro-consumer bill that's going to help 31 million uninsured Americans now get coverage. I think that people will realize that there are some great insurance reforms in this package. People will no longer, if you lose your job, you will still have the availability to have health insurance. If you have a pre-existing condition, you'll be able to get coverage. There will be no discrimination based on whether you're a man or a woman. I think that if we look at the administrative cost just of the back rooms of doctors' offices, that those will be much smaller, and there's a great provision for fraud and abuse and to cut the waste in healthcare spending right now.
What is missing for you in the bill, Senator?
Well, obviously, I think that the public option, the backstop option for people without coverage would have been good. But I tell you, I think the fact that we can still cover 31 million uninsured Americans right now will go a long way to really help healthcare reform in our country, and I'm very supportive of it.
Not quite 60 votes yet from what we read, Senator, and one of your colleagues, Bob Casey of Pennsylvania, has been tasked with writing some abortion-related language that could be part of the final Senate product, and he's trying to appeal to Senator Ben Nelson. What are you anticipating?
Well, I think right now there's a provision in the federal government, the Hyde Amendment, that prevents any federal funding going to abortion, and I think this bill upholds that. I think the Stupak Amendment in the House went too far and changed those provisions, but I certainly support the Hyde Amendment, and I think that we can move forward, and I think we'll, with some of the provisions that Bob Casey is working on to help pregnant teens and to help young women in college who become pregnant, that once again we'll be able to move together and merge that language into this bill so we can get to the 60 votes so we can have health care reform.